Dear students, welcome to Dr. B.R. Ambedkar Open University. This is Dr. Srikanth Vodnala, Doctorate in Management Studies and MBA in Healthcare Management. Today, we are discussing about the emergency department planning and designing. So, the emergency department as itself depicts an emergency as it is the life saving, the pivotal role plays for any hospitals and which is the first point of contact for the community to get in for the people who are in need and who are in unstable condition, who are injured, who are in critical condition. Therefore, understanding about the emergency department planning, which tells about us the location, the place of the emergency department, the kind of equipment to be placed, the kind of infrastructure to be placed, the kind of other utilities to be placed. So, we are all going to understand how ER is planning and designing. When it comes to the designing, it is the physical the presentation of the planned material in order to take care of the patient when it comes in an emergency. So, let us get into it. What is the role of emergency department in hospital? As I said, it is the first line of treatment and we usually call it as the life savior, because patient comes in a very unstable condition or a very critical condition, as the patient comes in a emergency condition and therefore, the facility should able to enable the preparedness for the emergency situation in order to save the life of the patient. And unlike other setups, if you look at the manufacturing unit, there is a closure hours. If you look at other commercial things, there are office evening closures, but when it comes to the hospital 24/7 it is working. So, there is no Sunday, there is no weekends, there is no holidays, regardless of the time and situation, it is up and run and available for all the 24/7. And as we never know when we get the trauma cases or emergency cases, therefore, it is essential for us to keep all the essential things. I mean, most of the time that we think hospital, which means the doctors, the infrastructure and the technical staff. So, the preparedness from the doctor side, preparedness and adequate infrastructure at the emergency and the preparedness from the technical staff is important to handle the trauma and emergencies when they come, as it also becomes the entry point for the critical patients. When we are talking about critical cases, it could be a entry for the intensive care unit, or it could be a entry for the operation theatre, or it could be a entry for someone who comes with the acute MI and who would need the primary angiogram or angioplasty. So, therefore, it becomes the entry point for all the critical patients, and the staff, the clinical team who represents the emergency team should able to take care the rapid decisions as required based on the clinical condition, and that is how the design should actually impact, it will actually impact the survival of the patient. How it actually is going to impact, let us understand little more about how the planning is supposed to be. So, let us understand what is the objective of planning the emergency department, because we said there are emergency patient, as therefore, that we need to do the rapid assessment. So, there are zones, the functional zones which comes into the picture, then we will talk about a little later. So, and our facility should enable and reduce the delays in the treatment, which means right from the patient when comes into the emergency department, we receive it, we look at the triage whether it is a red zone or yellow zone or green zone, then accordingly then we should able to where our facility, our ER planning should enable us to act so fast, which should reduce the delays in the treatment, and therefore, we definitely gives the patient and the satisfaction which we able to treat the patient, and we should also ensure the staff safety. The appropriate planning of the emergency department will also enable the staff safety, which will have a smoother patient flow. So, there is a uniflow of the patient. When patient comes in, we understand the severity, then we treat, then we send it to the inpatient, whether it is a operation theater or ICU care or a ward side admission, or they may be get discharged from the emergency unit after due observation as needed. So, and when we are planning the emergency unit, we should also be in compliance with the accreditation. There are many compliances which are even mandatory even for many processes, like even in insurance empanelment or even public sector unit accreditations, public sector unit empanelments. These accreditations are becoming mandatory. When the accreditation bodies comes for the inspection, they actually evaluate everything. So, how the ER is able to cater the services, are we able to treat the patient. So, there is the requirement for the 100 bedded hospital, what could be the emergency number of beds, and if it is a 200 bedded, if it is a 1000 bedded, this is stipulated number of emergency beds which are required for every hospital. Whether are we in compliance with respect to the beds, with respect to the facility, with respect to the infrastructure and all other utilities as well. So, let us see, as we are saying, emergency plays a major role, where it should be located and how our preferences should be. Naturally, when patient comes in an unstable condition or severely injured, they will come in an ambulance, or sometimes maybe they may be get them by the relatives in their private vehicle. So, our emergency should be in accessible situation where the ambulance comes near to the emergency, and therefore, it is ideal to have it on the ground floor. So, where, as I said, where we should have the direct ambulance access, and from there it is not just alone having it in the ground floor. And when the patient comes, as we understand their situation, then during the evaluation and further therapeutic conditions, he might need to send to the intensive care unit or to the operation theater. Therefore, there should be the direct connectivity from our emergency to the ICU and OT. And since when patient comes in a emergency situation, there is a lot of emotion actually. It is not just about the patient, there is the patient attendant and emotion. So, we should have a sufficient space to keep the patient attendants waiting area, and to make them sit and for the counseling session, and there are other so, and we should also keep the adequate adequate area for our utilities, then which I am going to cover as we talk specifically that what exactly is required in other department. So, there should be a separate public entry, and when we are talking about separate public entry, let us say that hospital we are talking about, it should be in ground floor, and there should not be the single passage for the regular outpatient department patient and emergency. So, when the ambulance comes directly to the emergency, and there should be another public entry for the regular outpatient department appointment or outpatient department related services. And we should also have a clear signages, even when any unknown person comes or moves out of our hospital or who crosses in front of our hospital, they should be able to know which is my emergency entry signage. Therefore, because during the emergency they may not or may have time to find out where is the way. So, our signages should indicate the clear way, this is the emergency department where they can directly reach out without wasting any time. Therefore, when you are taking care of all these things, which will enable us to do the faster response time from the arrival to the first response by the clinicians, first response by the nurse, first response by the primary consultant. There are multiple events where we understand the clinical in terms of indicators. So, if you can look at what should be the ideal size for a 10 bedded hospital, it is around 2500 to 3000 SFT, and if you are thinking for a 20 bedded emergency, and it is for about 4500 to 6000 FFT, which is essential as per the standard norms which is required for the hospital. And so, when we are talking about the criticality, the emergency of the importance of the ER, so how are we going to understand the subsections of the emergency, because it is not it is a combination of the clinical, non-clinical, the support staff, everyone, and therefore, the zoning of the emergency is very much important. So, if you need to understand it as a functional division of the spaces, then we got to understand the clinical which can be further we can mention it as a critical or non-critical, and there is a public way and there is a support zone. So, when it comes to and so the reason to have the functional zone of a clinical, public zone and support system to avoid the cross traffic, because if someone is simply coming for the OPD, should not get interfere with the emergency patients, which can delay in any of the service, or if somebody comes just alone for the diagnostic services, which they do not know how to see our emergency, or if somebody is so I mean or otherwise if our the wastage system or the biomedical system which goes out of the thing, or which gets in touch with our emergency, which again violates the patient safety in terms of infection control and other things. So, which definitely improves the overall efficiency of the system. So, furthermore, if you need to understand, as I said, the functional zone which we are talking about, red zone, yellow zone and green zone. Red zone usually it should be the very near to the emergency unit when the ambulance comes, and it should be the first one. The red zone usually it treats the high risk and high critical patients, and then the yellow zone usually treats the moderate risk, and the green zone usually treats the comparatively lesser patients or slightly unstable patients. So, when we are able to differentiate the patient based on their critical nature, therefore, our understanding about the ER should be placed in accordance to the patient criticality. So, therefore, it supports, and I mean there is the requirement to have for the your support to services, support to departments like your clean utility, dirty utility, medication room, equipment room, counseling room, and there is a space for reception and counseling. So, all this should be placed in such a way that our emergency patients should not get interrupted, and when these are actually evaluated, our system should also support, our planning and our layout should also support escort these patients to as required for the further admission. It may be in operation theatre or ICU or going to home after due observation. So, there should be unidirectional flow, and as I said, there should be a clean and dirty utility separation, which should not get in touch with the regular patient flow. So, how the patient flow? The same way as we are I have mentioned, the ambulance to the walk-in entry point, then it should pass through the triage where it is decided which zone that it is categorized, whether it is red or yellow or green, and then it goes to the admission or the discharge from the emergency. So, how and this triage system actually works? So, basically we are prioritizing, because we may be let it say that if we are having 100 bedded hospital and having 8 bed of ER, if we are loading up all stable patients in regular in all beds, then what if in case of any emergency case comes? So, that is the reason our triage system usually it works, and it prioritizes the patient based on their clinical assessment. And as I said, it should be located at the entrance, and we should able to reduce, and it will actually able to reduce all delays, and as it is a life saving system, and it is mandatory in every emergency system, the triage should be there, and based as we understand and evaluate in triage, it goes to the further zoning system. So, this is the, as you see in the slide. So, these are the types that I have categorized for a quick understanding and representation. So, the overall understand for the triage system is to improve the survival rate. Why it is so important? Let us say with an example that if a patient comes with a brain stroke, and if they are in a window period, we will not have a much time, or if a patient comes with an acute MI, where we may not have a time, the more we delay the services, it is the higher risk that we may lose the patient. So, that is the reason the triage plays a major role, and all these emergencies will come into the red zone, where the responsive team acts very fastly. So, if the when patient comes in a window period, as required, the medication or the further diagnostic evaluation will take in a quicker manner, so that we will save the patient. So, there is a resuscitation area, usually we see it as a the critical beds, where we have a crash cart, for the emergency drugs and the ventilator support when the patient airway gets blocked, as they may be not in a position to take the breathing on their own to support the other vital organs. So, we would be equipped to ventilate the patient as required, and our area should also have inbuilt with all medical gases. It could be oxygen, the suction, the medical gases should be come from the central station, so that we do not have to depend on the portable one. So, when the portable machines are there, there are high chances that it can get moved in any other place, or it can get placed in any other way, any other area. When the emergency comes, our team cannot spare time to get them from the different areas. So, as every bed needs the continuous monitoring, our bed should also be equipped with the monitors and the required things. In the ER, that we understood about, there is a zoning concept, and we are talking about red, yellow and green zone. So, what is actually required during the treatment area? So, every bed should be having that oxygen suction capability. It is equipped, should be equipped, and should have the privacy curtains. Sometimes we receive the female patients, sometimes we receive the injuries deeper to the privacy areas, where you should able to have the curtains to maintain the privacy of the patients, and the nurse supervision should be in such a way that it should be centrally located, where they have the clarity and visibility to all the patients. And it is also very much important to have the proper lighting. Adequate lighting is so essential for an emergency, and the equipment access. So, I will tell what exactly the kind of equipment we would needed for in the emergency department, that we will discuss little elaborate. And the observation area, where when patient not needed much of clinical aggressive, but still that they would needed little observation period, rather in admission, rather in inpatient services. So, we may get them stayed for a short period to get them stable, and which will also make the unnecessary admissions into your inpatient ward, where you are unnecessarily not blocking your inpatient bed with the basic monitoring. And of course, for every area, that your staff visibility and the nursing visibility should be the essential part, and the required documentation, it is essential in emergency. The documentation, whether it is a initial assessment, or if it is a MLC documentation, and your master records. The records plays a major role in the emergency department. And as I said, the nursing station should be placed in such a way that they should have clear visibility, and not just the patient, their monitoring system, the screens, the monitor should be able to view by every of every patient should be visible, and they should have a quick access to the drug trolley and the communication hub. So, they would need to involve the super specialist as required. Therefore, the communication plays a major role in the emergency department, and it actually improves the supervision when a critical patient is getting treated, which will also enables the speed response in terms of clinical outcome. So, when we are planning the emergency department, it is essential to have the doctor area as well, a space for a doctor near to the treatment zone, and he should able to access the entire data of the patient, whether it is a electronic medical record, fully electronic or semi electronic record. So, the doctor should able to understand the details of the patient through his area, and where the privacy is also ensured for a doctor. And the point of care testing is also very much important in emergency. What it means is, if you got to do a blood sugar, then you collect the sample and send it to the lab. It take couple of hours to come back. By then you never know whether patient is in a hypoglycemic situation or hyperglycemic situation. So, it is important to know the point of care testing. So, which actually tells and gives the rapid diagnosis, and it supports the trauma and cardiac care patients. It reduces the lab overall turnaround time and improves the door to treatment time. And of course, when we are able to do the diagnosis in time, and it also helps the clinician to do his treatment, which will definitely reduce the overall mortality of the patient. And some of the common point of care test which we usually do is the blood gas analysis, troponin as a cardiac parameter, blood glucose, lactate, electrolytes and hemoglobin. So, clean utility should also plays the major role in the emergency department, as we need to store the sterile supplies for emergency usage, and it is essential. So, it should have a restricted access near to the treatment zone, and people should able to do the hand hygiene protocols, and where you should able to give a provision for their hand hygiene, whether it is a hand wash or hand rub technique which is near to the clean utility is essential. And the procedure related, we will also have the minor or a small procedure room near to the emergency. Not every patient would require to get into the operation theatre. To support them, we would also need a procedure room. So, where your clean utility will also help the required supplying required material to your procedure room, and everything should be in compliance with the infection control. So, dirty utility again, so where and whenever you collect the contaminated material, which you should have a separate provision to store them, not in a flow where the patient goes in a unidirectional way to the other areas like ICU, OT. So, where that utility where you should able to store it, and from the area then it should directly go out of the place, or it should go to the place where the central biomedical waste segregation point is in place, where we should able to have the color coded bins, the biomedical waste state compliance and infection related protocol should be in place. So, the waiting area is also essential, when as I said it is a combination and a mix with the emotions. For attendance there should be sufficient waiting area, and outside the clinical zone adequate seating should be there. There should be continuous security and monitoring, and especially in emergency department you never know what kind of a patient comes, whether it is a mock of patients or a group of patients comes as there is a disastrous event. So, you should have a adequate security and monitoring system in place. The information desk should be available, and you should able to control the crowd anytime with your system which is available. So, in addition to those, for security and violence purposes, the security days, CCTV coverage, panic buttons, that you should able to train your people when to approach home. Your controlled entry should be in place, and your staff should able to know all the emergency codes. In the recent time, in fact, in all accreditation body, it actually trains the hospital that you should have emergency codes. So, isolation room is also essential in emergency department when we are planning, because we never know which patient is so infectious, and that isolation room is actually needed, the negative pressure preferred, and which I mean the overall idea to have isolation is to reduce the cross spread, the infection from this individual to the other patient, and there should be a provision to have staff PPE, and which should able to reduce the infection. And as I said, the emergency flow chart, when the patient enters, there is a triage, then resuscitation, then you do treatment or observation, or if required then you will send it to ICU OD ward, and then you discharge. This is a structured flow. And the safety measures what you supposed to continue is the fire safety, which is the most essential and mandatory thing. Your electrical backup should be there, at least 2 electrical backup should be there for 24/7 in case of any power failures from the public system. There should be emergency exit, and your fire exit plan should also be placed, CCTV coverage, and your violence prevention. Safety should be the first criteria, whether it is for a patient or a staff or a doctor, for anyone, right. So, infection protocol should be in place, and your quality indicators should actually tells us where you stand in terms of your emergency, and that actually guides us what to do in future. And your staffing is essential, because as we are talking about emergency department, it should be run 24/7. You should have a trained nurse, technician, security staffing, and all staff should be BLS and ACLS trained one. So, there should be a team coordination, then only the patient comes out. And as I said that utilities, so when we talk about utilities, it is a central medical gas supply. You should have continuous power backup, at least 2 power backups, and your HVAC system should be in place to maintain the negative pressure, and your water supply continuously, your suction should be working, you should have a daily, weekly and periodical maintenance and preventive aspect for the entire utility, and you should have a plan to execute. To conclude, the emergency planning and designing, your design should always saves the life, which means that it should be near to your entrance. You should not waste any further time to get the patient into the triage, and you should make in such a way that point of care should be in place, and the overall efficiency will also increase when you have a proper layout. Let us understand it in a quicker example, that if patient need to do hand washing and all the way, that if we need to travel from one edge to the other edge, whether the patient is in a red zone, so it is impossible to do these things, and it is essential for us to understand how layout actually help the clinical outcomes. And there are many national and international accreditations which will also help us to understand these regulations, standards for a better patient care. So, I always tell that well designed ER actually reduces the mortality, and the quality emergency care comes when you do a thorough understanding about all the processes. I believe that we have understood about the emergency planning and designing, through which then we can able to make the patient lives better, as is the responsibility of the hospital administrator. It is essential for us to understand. Thank you.